Let's begin our presentation. The goals of today's webinar are to understand the importance of submitting final report data promptly, to review the utilization of the program requirements document, to recognize the difference between competence, performance, and patient outcomes in terms of our CME application, to develop CME application activities and application responses that effectively describe the desired improvement in learner competence, performance, and/or in patient outcomes, to understand when your application, your CME application, is fully approved, to learn how to navigate the CME platform to access the updated disclosure summary. We're going to share CME best practices for both members and non-members, and we'll go through a few state regulatory mandate reminders. I'm going to cover the refresh section and revisit some of the key takeaways from our last webinar back in January. If you can recall, back in January, we requested final reporting from you. Thank you so much for submitting it. Last year, from our internal and external activities, ACS accredited 4,236 educational activities. 52,522 CME credits were awarded. We had over 110,000 physicians who participated, along with 15,265 other learners. Wow, that is commendable. A lot of work goes into making these activities successful, and we continue to ask that you submit all requested information to CPDA as soon as possible. We can help you get accredited. Next slide, please. So there is PARS data that we ask that you input in your application once you have collected it. PARS is ACCME's activity reporting system. There are only two components that we ask this of. The financial summary, which includes grants, exhibit fees, and evaluation data, which includes the number of participants and evaluation responses. Next slide, please. So this is a screenshot of the application portal. As you can see, each line has a specific line item for you to input the attendance of MDDOs, non-members, and non-MDDOs, and evaluation responses. And we also have another slide of the financial summary section in our application. Again, please input the data in each line item as soon as possible, and you can always let any member of our CPDA staff know if you have questions. In our last webinar, we did discuss the program requirements document, and I just want to reiterate the importance of this document. It serves as a guide to what is required to be displayed in your final programs. Following all the steps of the program guide helps to ensure ACCME compliance, and CPDA provides this to you when your application is pending approval. So now Ryan, he will take us through the latest and greatest information from the ACCME at this time.
Okay, good morning, everybody. Thanks again for being here. My name is Ryan, and I'm going to go through the news you can use, or the ACCME highlights section. As you may or may not know, we are in contact with ACCME pretty regularly. They send us newsletters and things about just sort of things they're focusing on and other important aspects of the CME world, and those are the things that we want to share with you. And today what we're going to talk about is a little bit about application responses, and they're basically just some of the why questions. Those of you who have gone through the application will notice these, and it's just I just wanted to give you a little bit more information on those three things and how they apply to CME, etc. Okay. So as you know, we are all in the business of continuing medical education, and as we know, physicians rely on this accredited CME to drive improvements and keep learning and make them better doctors. So CME isn't something that is taken lightly, as it should not be, and that's why the ACCME does require these things that are on the application that you fill out, because what they want to see is sort of a roadmap for what you are seeking to achieve through your CME activity. And how you do that is through the application, those application questions. And the ones we're going to talk about today, the specific aspects are expected learner changes in terms of competence, performance, and/or patient outcomes. Again, those of you who have done a CME application before are quite familiar with these terms. So I'm just going to go through them a little bit today, like I said, and more in greater detail. So let's travel over to the CME platform where you're actually going to encounter these three things. As you can see there, there's a screenshot of the CME application. And there's our three words, competence, performance, and patient outcome. And it says up here, how will this activity improve the learner's competence? And here they call it knowledge and action, performance, skill set, and/or patient outcomes, impact of care. And here's a little link that you can click on if you need help, and it gives you all sorts of information on these things. But here are the three components that you want to talk about. And this basically is where you describe some of your roadmap, the roadmap that I was alluding to in the previous slide. So this is simply asking, I say simply because it's a little more complicated than just giving a kind of a generic answer. Is the goal of your activity to improve the learner's strategies or skills? If so, then you would complete the competence section and fill out some information in the competence area. Is the goal to improve what the learners will do in practice? And if so, then you would fill some information out in the performance section. And then lastly, if your goal is to improve improve patient outcomes, obviously you'd put stuff in there too. The important thing to note is at the top there, right here, you see and/or, because not all applications are going to touch, or not all CME activities are going to touch on all three of these. Most of them do, all of them kind of do, and I'll sort of get into that when we talk about the evaluation in a little bit. But you don't have to answer all these. Say you're putting on a 1-hour skills course. You wouldn't necessarily fill out all three of those for that. If you have an annual meeting, there's probably going to be a little bit, you're going to have your activity is going to encompass a lot of different courses. So you would put your answers in there. And this also can be quite daunting for those of you who are not directly involved with the activity to describe these things. So planning committee is obviously, these things should be basically ready to go when you fill out the CME application, because they're based on learning objectives and educational objectives that have already been established by the planning committee. So if you're in on those meetings that give you planning minutes with their objectives and stuff, you can extract this information from the data that you already have and fill it in there. And sometimes the applicant is the person who is in charge of the meeting. So you should know what you're trying to teach and what you're trying to get your learners to learn. So yeah, if you're struggling to write these, always lean on the planning committee, those, like I said, and the learning objectives faculty too. So, and then some of you might be asking, okay, well, how are these things measured? Or how do we know that it's going to be, we're going to improve this competence and things like that? Well, that's when the evaluation and the post-survey come into play. The evaluation, as you know, it's 15 questions is required. The learner takes that immediately after they finish the course and ask questions about performance, competence, and patient outcomes, and many other things that they can answer right away. And again, not all of them apply. Some people just put, not applicable. But then when the post-survey goes out, which is obviously optional, but that is 60 days in advance, that's when the learner is able to reflect if they did take some of that stuff they learned, the competence, and then they used it in their practice, they would be able to measure their performance and also measure the patient outcome. And that's why while the post-activity survey is optional, it's extremely important in terms of this sort of data collection. And just because we have 15 questions on our evaluation doesn't mean that you can't have your own as well. You can add questions that will help if you want to focus on another part of learning or something, you can add your own evaluation questions onto the 15 that we already have. So it answers some of the questions that you are looking for specifically for your meeting. So I'm going to briefly go through the three areas we're talking about here: competence, performance, and patient outcomes. So we'll start with competence. And the ACCME has many different ways of explaining this. So I have several different sort of definitions that I'm going to go through, or that I'm going to put up here that you can see. And then once I give the examples, it makes more sense once you see the examples. But according to the ACCME, competence is knowledge put into action by the learner. Ability equals competence. Knowledge in the presence of experience and judgment is translated into competence. What you would do if you could do it. But here are some examples. An operative skill. Your course is teaching an operative skill, device use, something like that. You are trying to improve the learner's competence. Okay, they are learning something that they can use in their practice, in their work on a day-to-day basis. So ask yourself, how is your activity going to be improving competence, basic skills? And if you need to use any resources you can to answer that question. And most activities do teach something along these lines. So the next one is performance. And performance is the skill, ability, and strategy one implements in practice. So that's what they're actually doing. And that's in performance is when you put the competence into action. Okay, and some examples of performance would be better surgical results, higher patient communication ratings, fewer coding errors. So think like a course, a simulation course, perhaps, where you actually would get results on something you were working on right there. I mean, I know it's not technical, it's not a patient, it's not a real person, but you'll be able to get some data from that. Also, like everything else, how does your activity aim to improve this performance? And the evaluation and the post-survey are extremely important on this one as well, because it measures, if you get that eval right off the bat, it asks you, will this improve your activity and performance? Ask the learner if it will, because they don't know yet. So a lot of people say, yeah, of course. But then the post-activity survey that comes 60 days later, that's when they can really answer, it really has helped or it really has not. And that's when you can really get the good data from the post-activity survey, once people can reflect and see if it's made an impact on their practice and on their patients. And lastly, that's the last one, is patient outcomes. And these are the health characteristics or outcomes related to individuals or groups of individuals within a geographic location. So this is just sort of the targeted people that you are learning skills and performance trying to help. Examples could be incidence and or prevalence of disease, mortality rates, vaccinations, things like that. So again, these would be measured with the post-activity survey, most importantly, because unless the course was actually like a study, when you did study a group of learners, so within a defined area, so then you could really focus on patient outcomes. It's up to obviously how you want to set up your course and what kind of course it is. But you need to ask yourself these questions when you're setting it up, so you can satisfy the ACCME requirements. But at the end of the day, the point is delivery of safe and effective care. And the ACCME requires that you decide what it is you want to measure as a result of your educational activity. So in conclusion, when you come up to these questions, do you want to measure what they would do if they could? Do you want to measure them in practice? Or do you want to measure the consequences of their actual performance in practice. So that's what you want to think about. And most of you do a great job. We appreciate your efforts. We know these questions aren't easy, but always consult your planning committee and anyone else that has that access to the course, learning objectives. These will help you write some good answers for these. So that is it for me. Thank you for listening, and I'm going to pass it on to Olivia.
Okay, thank you. So I'm going to touch on some important reminders and an update. So we can go to the next slide. Okay, so as a friendly reminder, we would really like to reiterate and request that you please do not rely on your personal stash of documents as you complete an application. This includes old accreditation boxes as the language changes and our logo has been updated. To ensure you're using the correct information, please always refer to the provided program requirements document and be sure to download the templates in the application each time you apply for CME. It'll guarantee that you're using the most recent and up-to-date files as we continuously refine and edit our documents. And additionally, please also note that upon receiving your CME and completion certificates via the CME application pending approval email, your activity is not yet fully approved, and full approval is pending upon completion and approval of the pre-activity steps on the CME platform. And keep in mind that your pending approval email will contain instructions and next steps for obtaining full approval with guidance as to what is required for the pre-activity step and how to upload the required documents. So we'd also like to inform you that there's a revised disclosure summary, which is part of the previously mentioned pre-activity step. And I've included a screenshot of where you can access the document as you work through your application. And as a reminder, you have access to the pre-activity step after you receive your pending approval email. And the disclosure summary is used to compile your disclosure information for speakers, faculty, moderator, discussants, authors, and presenters in lieu of submitting individual disclosure forms. And we've updated the summary to align with our individual disclosure forms. And I'm going to share my screen to walk you through the revised file. So on this updated form, there's now 2 separate columns for mitigation options as opposed to 1. And there's one for non-ownership mitigation and another for mitigation that's applicable to individuals who are owners, employees, or stockholders of privately held and eligible companies. So they're right here. And if you receive a disclosure form indicating that an individual has an ownership relationship, the chair or designated official will review the mitigation section on the form to assess whether the individual qualifies for an ACCME exception. And you'll take that information and add it to the disclosure summary under column K, which is right here. So for example, in this disclosure summary, John Smith is listed as an employee of Hearing Contrast LLC. And because he's an employee of an ineligible company, you would need to use column K to mark the appropriate mitigation option using the dropdown. And as I previously mentioned, this column correlates to whether an individual meets an ACCME exception or not. So here's the dropdown, and then here's the dropdown for non-ownership. So again, this new form is listed on the CME platform, and you can also always email us at cpda@facs.org to request any documents. Okay. So Ryan, I'm going to stop sharing my screen so you can reshare yours, and I'm going to pass it off to Marilyn.
Good morning again, everyone. We're going to just briefly go over the MyCME and the state regulatory mandate, please. As a friendly reminder, we want to ensure the best practices and resources are used when we're trying to meet the licensing and certification requirements. One of the things to note that we do have members and non-members in our system. The members can use the MyCME platform to manage their credits, view, upload, track activities, and share their CME credits with the ABS. Also note that for non-members who use the MyCME platform, they also have the ability to view and send their ACS credited activities to the ABS. That's one of the things we wanted to make everyone very clear on. It is important to note that the members and non-members must have an ACS ID number upon registration. What we are finding is that a lot of the on-site activities that take place, some of the members forget their ID. And so they'll create another file. So to avoid this duplication efforts or to avoid any discrepancy in members getting their full CME credits, we want to ensure that they have their ACS number handy. So I encourage your program coordinators to make sure of that upon registration. Another best practice item to note is the attendees should frequently check their information. We also find that they may have their personal email, but in our data system, they may have a preferred email address, and then they're looking for their CME credits, but it's not there, or they're not getting the communications in a timely manner. So please encourage them to check their email and phone information as well. And again, as I stated previously, members and non-members can both use the MyCME for ACS accredited activities to send over to the ABS. Next. So the best practices, again, the attendance and reporting the data transfer. Please be sure to upload your attendance information using the attendance template. The template that is provided to you will make sure that all of the data that's within that is uploaded carefully is entered to the system so there's no discrepancy. And please be sure that following that attendance upload, your learners can, again, transmit their credits to the American Board. This is not an automatic transfer process. A lot of people feel that it is. It is not. Members must log into the system, and both members and non-members who are currently enrolled are able to send their information over to the ABS. Next, please. So there's some of the state regulatory mandate reminders. There are CME requirements that the state licensing boards may require. The majority of the state licensing boards have content-specific CME requirements. So when you're planning your activities, please be sure to check our website for the state regulatory mandate descriptions. We also have them listed in the next slide that I will be referring to in a second. And think about if the course will target learners from specific states. So again, you may want to just take a look at this before you're planning your meetings to make sure that you know your state medical board's approval and process and policies in place before you start your activities. Ask the question, does your activity address some of the content specific by the state licensing board? And do you need to include language in the title of your activity to meet the state licensing board requirements? Next. As I stated previously, here on the screen you will see a list of the state regulatory mandate descriptions, the states that are involved, and any boards that it refers to. So again, how many credit hours are required in a specific content area over what time span is important when you're planning your event. All of this information is available on our website. And again, if you have any questions, please be sure to refer to the MyCME team for any questions. Thank you. And now I'm going to turn this back over to Data. Thank you for your time.
Thank you, Marilyn, and thank you everyone for your presentations. Let's go to any questions that may have arrived in the chat. And from what I see, there are no questions in the chat right now, but we can certainly open up the floor to a Q&A if anyone has any questions or topics that they would like to discuss.
Yes, we're going to maybe give you back some time, everybody. But please, if you have any questions, unrelated, related, please feel free to ask them now. If you'd rather just email them to us, you can do that too. Excuse me. So I do see that Chantel, you asked about downloading. The document would not download. Is there a page to get documents? We don't have a page right now, but it is something we're working on to get a page, or not a page, just like an area, because a lot of the documents that you are able to download, they come in different stages. As you guys know, the application locks. So you could be in the first part and you might want to get a document from the second part, but you can't get to it because it's locked. So what we're doing is we're in the middle of getting all of these documents and putting them to one place that you can access on the platform, so you don't get sort of, because once you can't get to it, like say we're reviewing it or something, and you may want to jump ahead and get a document to start working on it. That's something that we're going to fix. And you can always email us if you need one. That's another thing why Olivia was saying, because sometimes that happens, and that's why you have to rely on your personal stash. But please don't do that anymore. If you need the most current one, if you had yours for a while, just reach out to whoever your account manager is, or just email the CPDA inbox, and we'll be happy to send you the most current one. Okay? And I'll let you know if we'll let you know when that page is up that has them all there for your choosing. Another question from Olivia: is there no longer a trauma regulatory mandate? I do not see that on the list. Okay, there is. So that must be some sort of a tech thing. So I'm going to write that down, look into it, Olivia, and I will get back to you. Does that sound good?
Yeah, thank you.
You're welcome. Anyone else have anything at all? Any questions about what you saw? Anything related, unrelated? Here's our contact information, as you guys all know, if you ever need to get a hold of us. You have our individual emails. Anything else that anyone has at this moment?
Jake, I had a question about the disclosure where you said that there's a second choice for the resolution.
Mm-hmm.
What's the implementation of that? Obviously, some activities are in the process of planning.
Yeah.
Is this going into effect for next year, or what's the timeline?
This has been in effect for since the new rules came out in late 21. Basically, what it is if you have your financial relationships that your planning committee or faculty will report, it matters what there's differences in levels of financial relationships, basically. So if somebody's just a consultant or works with an ineligible company one time, gets royalties, something like that, then that is considered low level, where you can use the standard mitigation strategies that are on that have always been on the disclosure form, right? But now the ACCME has altered things where if your relationship with an ineligible company is at a higher level, and when I say higher level, if you're an employee of an ineligible company, because you're technically beholden to that. If you're being paid, you have to follow their guidelines. So if you're an employee or an owner, if you own stock in a privately held company, you're considered an owner as well. And technically, according to the ACCME, not technically, according to the ACCME, if you have an ownership level relationship or an employee level relationship, you are not allowed to participate in CME events. The only way you would be able to is if you met one of the 3 exceptions that the ACCME has, and that's why we put a different section into the disclosure summary, and on the disclosure form as well. There's a section for these owners and employees, where the designated official, the person who is in charge of the planning committee, the one that reviews all everybody's disclosures or relationships to determine if they can indeed be mitigated, this person's responsibility would be to look at this high level ownership or employee relationship and determine if it meets one of these 3 exceptions. And if it doesn't, the person can't participate. And that's why that new section is on the disclosure summary for the faculty, that if it is an ownership level, they would use just one of those exceptions to mitigate that high-level relationship. And if it doesn't meet any of those exceptions, the person can't participate in the CME activity. Does that make sense? You're welcome.
Yep.
Anyone else? Okay. Well, thank you very much for coming. We will be sending out the slides for this. I'm not sure about the recording. We might do an audio over the recording and get that out to you, but it might take us a little bit to get the actual video out like this, just because of there's lots of reasons. But I will send you the evaluation and slides a little bit later today. If you could fill out that eval, tell us how we did, what else, what other topics you need. If you have any questions that you remembered in the meantime, please feel free to write them on there, email us, let us know. We're here to help. So please reach out if you guys need anything at all. And yeah, thank you all for coming and have a great day.